site is like an hour from your house, you may be able to get something closer with some of the existing health systems. And so this is not meant to, oh, there we go, got the legislators. This is not meant to be the exclusive way to do it. This is supplementing what had already been done prior to that. The target audience for this early treatment are really the people that are most likely to suffer negative outcomes from COVID. And so, of course, elderly, people that are immunosuppressed, people that are overweight, people that are diabetic, people that have kidney, heart, or lung conditions. If you're somebody that tests positive and you come in early, you have a great chance to have this resolved. If you look at how the emergency use authorization is structured, pretty much if you're age 50 or above, chances are you're going to qualify under one of these. And so if you find yourself in a situation where you've come down with COVID, just know early in that process coming here is a great way to be able to resolve it. Once this progresses to the point where you really need hospitalization or intensive care, the antibody cocktail at that point, the virus will have progressed too far most of the time for it to really turn back the clock. But if you get it early, it's got a really, really strong record of success. And so at the end of the day, we just want to give everybody the maximum number of tools to be able to apply. And so, again, if you're in these categories, regardless of your vaccination status, this is something that could be benefit from you. Now, if you look at the health systems throughout the state of Florida, most of the people who have been admitted and are being treated for COVID. When you look at the admissions, that counts anyone that's COVID positive, which when you have high prevalence, you have probably 25 to 30% at a time that will be admitted for something else. They test everyone that comes in, you test. So you're there really for something else, not necessarily for COVID. But if you look at the ones who are being treated for COVID, the overwhelming majority of those folks being treated for COVID are not vaccinated. And so that's held up pretty good throughout this summer wave. Now, people who are vaccinated do test positive. They call them breakthrough cases. I mean, I maybe just need to dispense with that because it's not really been rare. I think there's been a lot of people who've been vaccinated who've tested positive. Most of it is modest and mild, which is good. And at the end of the day, the purpose of a vaccine, whether on the front end or even a monoclonal on the back end, is really to prevent serious illness. I mean, if you have a mild fever for a day or two, then you get over it. Those are things that people live with. And so you do have people testing positive. Most of it's mild. Most of the people that progress to hospital admission are people that had not been vaccinated prior. It's also the case, talking with the health systems, of the people that get admitted for COVID, over 90% of them didn't get the monoclonal antibody either. And so I think part of it was just a lack of knowledge about this being available. For whatever reason, some people thought that this was something that was exclusive. Some people thought it was like super expensive, which is not true, at least the Regeneron. And so there's just different reasons. And so there wasn't as much knowledge. Now I think more people know about it. Obviously, more people have been able to do it, more positive results. People tell their friends and family that what happened, and so you do it. So it's here to be able to go. It is not a charge to the patient. You hear people put out stuff saying that this is thousands of dollars. Now there's two other monoclonals. There's the Eli Lilly. Now that has not been proven to be as effective against Delta. Then you have one from GlaxoSmithKline, which is newer, and we think it holds up against Delta, but that's not one that the federal government has bought the stock of. And so you don't see a lot of that in the U.S., but to the extent you would, that would be something that would be like any other medical treatment in terms of cost. The Regeneron that we're offering here, federal government bought all of this last year, and so whatever's being drawn down was paid for long ago, and so the Florida's not being charged to draw it down, and then when the patients come in, they're not being charged for it when it's applied to them. And so don't let rumors or kind of false narratives about this being something that would be very costly to you dissuade you from coming in. You're going to be able to be treated with the Regeneron, and that's true. The GlaxoSmithKline, I think it's performed pretty well. I think people have had pretty positive views about it. It's a little bit different than the Regeneron, but that one is one that the federal government has not bought the stock for, and so it would be treated just like any other medication. And Dr. Shepke may weigh in about it, but we have not seen a lot of these systems offering it. Most of them are offering the Regeneron, and that's just been the one that's being used. So just understand it's available, it's accessible, and there's not going to be any financial considerations that are going to keep you from being able to access this. So we're happy to be able to bring this here in Sumter County. So we have, if you look at the central, you have North Central Florida, Gainesville, you have Alachua County, you have Sumter, and we have Orange, we have Polk, we have Volusia, and we have Brevard. So in that kind of region, you have a lot of different options there. And then obviously you have pretty good health systems throughout the region as well who also offers it. And again, we're supplementing what's been going on. We do offer at these sites the ability to get it subcutaneously. Most of the health systems have been doing the IVs because that's how it was initially approved when it was given the EUA. Since then, the Regeneron has been approved to do it subcutaneously. So if you do that, you don't have to be hooked up for an hour. You do the shots, and then you are observed for an hour after that, but you can end up having higher patient volume. Some of these places with the infusion centers, by the time someone comes in, they get situated, they get the infusion, then they're observed. I mean, that's several hours that could elapse. And so they're just limited in how many patients they may be able to get in. We here are taking advantage of the versatility of the Regeneron, and we're using it to be able to get more folks to be able to have it. So having a lot of success with it. I think people are happy to know that there's an option early because we hear so much about, a whole bunch of different things. We had not been hearing very much about this for many, many months, even though it was something that, we, from the very beginning, I mean, I was happy it was available and spoke with the hospitals, and they've been doing it the whole time, but it really had not gotten in, I think, to the public the way it should. Now I think more people understand, more people are using it, and we've had some really inspirational stories of people who were really high risk, who were able to come in and get the treatment, who are back on their feet and feel a lot better. And that's what it's all about, just help keep people out of the hospital, saving lives, and making sure that they have, and again, no one's forcing anyone to take this. It's your choice. You got to do what's best for your health. But just know there is an early treatment option that has a proven record of effectiveness. So thanks for the folks at the Villages. I saw Gary Lester here for making this facility available, and I think it's going to be very effective. And the word spreads very quickly here, so people know that if you do test positive, this particularly if you're in those high-risk groups, this is something that you can come in, you can get. It's very efficient the way they do it. And I think you'll end up seeing some good results here like we have throughout the rest of the state. Okay, I'm going to have Ken Shepke, as the Chief Medical Officer for the Florida Division of Emergency Management, come up and say a few things about what we're doing here.
Thank you, Governor. I'd like to thank some of my colleagues who recently took some of their precious off-duty time to come out and promote the vaccines, because I think COVID is going to be with us for the foreseeable future. We really need multiple tools to combat this pandemic. I appreciate the governor's leadership on adding the second major tool to the first one, which is the vaccines, which is really for prevention. And I know there are a number of folks who were kind of on the fence about whether or not they would get the vaccine because it didn't have full approval yet. It was a little bit new. And I think some of them can be a little reassured now that at least one of the vaccines now has full FDA approval. We've had studies now that show it's safe in pregnancy. It's been around for a year and a half now for some of the folks that were in the original studies, so we see really good long-term outcome safety data on that. And literally millions of people in Florida and hundreds of millions of people around the world have received these vaccines. And so we've got a lot of good data on it. We have a little more track record. So if you're on the fence, I, like my colleague, would encourage you, go ahead and get that vaccine as the best long-term preventive measure. However, that doesn't really help you if you get sick now, because those vaccines can take up to 6 weeks to develop that protection. So what we were missing is the treatment arm, and thanks to the governor's initiative, now that treatment arm is really in place in Florida. We've got pretty widespread accessibility to these monoclonal antibodies. And yeah, there's about 3 of them currently that we can use that directly attack the virus. Unfortunately, one of them, the variants have developed resistance to. The other one from Glaxo, the sotrovimab, that one looks very promising. It's newer, it's smaller studies. but it's not approved for either subcutaneous or for people who've been exposed and don't yet have the disease, something we call post-exposure prophylaxis. It's not approved for either one of those, and as the governor mentioned, that's actually would not be free to the patient, whereas the Regeneron really ticks all the boxes for us. You can give it subcutaneously as well as intravenously. It works against all the variants, including Delta. It's highly effective at preventing severe illness, hospitalization, and death, and it works for post-exposure prophylaxis. So it's really like, and not to mention, it's been proven in multiple large studies, up to over 15,000 people, that it's very highly effective. So it's great that we have this. We're hearing great stories from around the state, success stories. One person that I think has been in the news quite a lot, when we first opened our site in Jacksonville, we had a woman that was so sick that she was laying on the floor, and I think that picture has kind of gone viral. I had the honor and privilege to actually speak to her, and she really credits this medication with saving her life. She told me that the folks at Jacksonville Center were wonderful. They treated her gently. They got her the treatment, and she is convinced. I mean, the story is a great story. She got sicker and sicker with COVID. She was unable to get vaccinated because of medical reasons. Her mother, a 77-year-old mother, had watched some of the governor's news conferences on monoclonals and told her how she could go to the Jacksonville site to get the monoclonal therapy. And she thinks that without this therapy, she would have been one of those folks into the hospital, in the ICU, on a ventilator, and perhaps died. And she credits this medication with saving her life. And Governor, I thank you for your leadership on this topic. I think it's great for Floridians.
We did have some of the legislators here, so I want to, Senator Baxley had been here. We have Representatives Hage, DeSigli, McClure, and Danny. Is Danny Perez here? Okay. Welcome, and thank you guys for being here. And so, I think what we're seeing is if you get this early, you got a high probability of success, very effective. On the front end, the people that were vaccinated, less likely to have severe illness, and less likely to be hospitalized as well. So if you look at the various tools that are out there, the extent people just take advantage of those, really takes this and makes this something that is, effectively a flu-level type risk. And so, but you gotta avail yourself of what's out there. And again, this is not required for anybody in terms of the early treatment. It's there. You got to make your own decisions. But it is something that we are seeing positive results for. And obviously, you learn a lot as things go on this stuff. You got to be able to respond to the data. Clearly, the vaccines are keeping most of these people out of the hospital, but we're not building the herd immunity that people hoped. I mean, if you look like in Sumter, I mean, you've got a huge percentage of people, adults, that have gotten shots, and yet you've still seen a wave when people said if you just had 50%, then you wouldn't see these waves. In fact, you look at places like Israel, you look at some of the places we have in Florida that have very high rates here, Miami-Dade. You look at some of the places on the West Coast, Hawaii, some of these places. So we just have to understand that that's happening and understand that, okay, so there are going to be infections. It's an airborne respiratory virus. What then if you end up in that situation? And this is something from an early treatment perspective that's got a proven track record. And I think for most of this, a lot of people thought if you get it, you just kind of wait at home and hope you don't get really, really sick. And that's not necessarily the extent of your options. And so we're glad that this is here, and we're glad that we're able to expand it to more and more Floridians. Any questions?
Governor, I have a question for you. Roughly half the school children in Florida right now are going to school that has a mask mandate in place. Have you considered going back on your executive order and maybe returning that power to the local school districts?
How about keeping the power with the parents? Those school districts are violating state law, and they're overriding what the parents' judgment is on this. There are parents who have kids who have already recovered from COVID over the summer, who have immunity. That's been absolutely demonstrated. And these school districts are saying, no, you have to wear a mask even if your parent doesn't want that. We have 5-year-olds and 6-year-olds that are being forced to do that against their parents' wishes. And so we have a parents' bill of rights in this state. We think the parents are best situated, to make that decision. And if these entities are going to violate state law and take away parents' rights, obviously there are, it's the way it works. There's consequences for that. There'll continue to be more, and I think we'll see that. But just understand what they are doing. I mean, they are thumbing their nose at the rights of parents. Some of these districts had let parents, had honored the ability of the parent, and then they're taking it back after being able to do it. So, parents clearly are in the best position to be able to do this. That's what state law says, and I think that that's the way to go. But, nobody is above the law, and you can't go above the law and take away people's rights. And that's what they're doing. They're taking away parents' rights, and there will be consequences. Yes, ma'am.
Governor, we've had a lot of cases this school year, the highest jump ever recorded in the pandemic in Orange County on Monday. We've had to close down a school in Osceola County. So it seems like these optional mask mandates aren't working as well.
How do you know they weren't wearing masks?
Well, I understand that right now we're seeing the most cases ever, and we have 30% of
Right, but what percentages of those kids were wearing masks? I mean, the idea that the mask, we have a whole year under our belt in Florida. The majority of the districts forced masks. The minority did not. The results were not statistically significant. So yes, there's going to be positive tests. There were last year. There will be now. We're starting school year where the wave had already crested last year and it was really down. This year was more in the middle of it. And so that's just the reality. But to attribute that to the mask, you don't even know that they're getting infected in school. And in fact, the evidence is that they're much more likely to get infected in the community and at home than they are in the classroom. And so I'd be very careful. I understand, respectfully, people in your profession love having kids in masks. I get it. You guys have taken an editorial position on that, very clear. The data doesn't support it. There's a great article, actually, in New York Magazine, of all places, that went through this 3,000 words, very thorough view of all the evidence and lack of evidence. And I would point to, England just put out school guidance. You have other countries in Europe that have been doing it where they're respecting parents' wishes, and the results have not been any different. So attributing it to that or not, I think is a mistake. And I think what we've seen is, obviously, most school districts are following Florida law. You don't see any major differences between the districts that are following the law and the districts that are breaking the law, with respect to this. So I would just say that, we're in a situation where I think parents can best apprise that. I also would say, look at how Europe's handled it. Look how England is advising. Don't send healthy kids home. If they've been exposed, tell the parent, let the parent make that decision. But if people are healthy, they shouldn't be sent home. Recognize kids that have immunity conferred through infection. Do not send a healthy immune kid home, unless they're. So I think that there's a lot of things, but at the end of the day, I think there's a lot of people that want to politicize. Remember, a lot of the people who are the noisiest about some of this wanted the schools closed last year. Remember, I got sued because they wanted the schools closed. They didn't want to even have to open the schools. And so I think these are a lot of the same people who don't want to follow state law and who are kind of, going about it that way. But at the end of the day, I can tell you, we think the data is very clear, and we think parents should be making those decisions.
Governor DeSantis, I have a question. You spoke about the proactive measure of getting vaccinated. You also talked about the importance of the reactive, which is antibody treatment. So speaking of masks, what role do you feel that masks should play when it comes to?
They should not be mandated. No government entity should force you to do that. That is your choice. If that's something that you believe provides you protection, no one is going to say anything to you, but that should not, absolutely not be mandated. Obviously, it can't be mandated in the state of Florida, and that's an individual's choice. I will say that from a scientific perspective, you have even some of these experts now are acknowledging with an aerosolized virus, a piece of cloth is not going to stop the aerosols. When they started doing the masks last year, the thought was it's respiratory droplets, and so the respiratory droplets, maybe you could intercept some. But when you're talking about aerosol transmission, something that's very highly contagious, just understand what an N95, a medical mask, that will intercept some of the aerosols. But just a piece of cloth is not going to do that. Osterholm, one of Biden's advisors, has acknowledged that. You got other people that are acknowledging that. But look, I leave that to people to make their own judgments. If they feel comfortable with that, do it. But absolutely not should that be mandated in any way. And you've seen places that have done the mandates and they've had huge increases, even above, what Florida has. Louisiana per capita was significantly higher than Florida this summer. So, yeah, I think that that's a choice, and that's what we trust people to make their own decisions in this state. We are not going to be bludgeoning people with restrictions and mandates and lockdowns or any of that stuff. It hasn't worked, obviously. It has immense cost to society, and so you're going to be able to make those decisions for yourself. And I think our job is to be able to protect your right to be able to make those decisions for yourself.
You mentioned additional consequences. What do you mean?
Anyone else who hasn't had a chance to ask? Yes, ma'am.
I haven't asked one yet.
There are some people in Orange County that are trying to get appointments today, tomorrow. There aren't any available till the weekend. Is there anything of opening even more sites?
We should, I should figure that out, because, if you look at, they're not doing 320 a day in Orange County. They haven't yet. I think they did 180. I know they're seeing some walk-ups. Do you want to weigh in? Where are we on that? Because I know that they're not booking 320 appointments, so there is some ability to do walk-ups.
And you're absolutely right. We're adjusting the appointment scheduling. They had set aside a certain number to allow for that walk-up, but when the walk-up demand doesn't meet, they need to open up more appointments. And I think they're constantly working on adjusting that as we see the local demand and for the Regeneron. Oh yeah, and we've treated I think it's over 10,000 people across the state of Florida now. And what we see is each site, as we open it up, it starts off a little slow, and then as the local populace and the local physicians understand that they've got that resource, it really starts ramping up. But as the governor says, I think we're meeting the local demand at each of the sites. And the reports I've gotten, I've literally spoken to dozens and dozens of people around the state, is they're able to get those appointments the next day or 2 days. And it's really important, and it's an important message. This is something we want you to get early. Like every other medical treatment, the earlier you get it, the more effective it is. So if this particular site, we'll look at the scheduling there and make sure they're opening up enough to make sure that folks can get in there right away.
Yeah, I think it's important to, and so we're going to look into that, because it is important to do it early. And so if you are booking somebody out 3 or 4 days in advance, but you're doing 180 when you have the ability to do 320, are you saving that for walk-ups or whatnot? So we're going to look into that, because I think at the end of the day, we want everybody to get treated who needs it. And the earlier, the better. Look, maybe some of these people that wait a few days, maybe it ends up being okay. But I can tell you, the minute you know you need it, get it. And that's really what we want to be able to do. So I know some of these sites have walk-ups. So we'll look at the Orlando one. It has not done over 300, though, in any of the days. It's been open now a week or two. It has not maxed out on the daily, at least when the numbers we're getting. So there is more capacity. If we do need to expand capacity, we probably can expand within that footprint. And I know we've thought about doing that in some other sites as well. It hasn't been required yet, because we've been able to manage. But yeah, I think to book people out too far in advance on this, it's one thing to book people a week out, unlike when we were doing the vaccine, because obviously a lot of people wanted it, you had to do it, whatever. But this is very time sensitive, and I think it's important that we're able to get it done. So one more.
Additional consequences for schools.
It's a great question. So if you're somebody that is COVID positive, should you talk to your physician before coming here? The answer is you absolutely should do what you think is appropriate in that regard. You do not, however, need to get a prescription or a physician referral. The Surgeon General in Florida has issued a standing order. And so you can come in without having done that. And again, we're not saying don't consult, because obviously I think you should consult with your physician on all this stuff. I think that's healthy. But it's not going to be an issue of where, the doctor's not in the office, I can't get the prescription, so I can't come to the site. No. The site's open. There's a standing order, and you be encouraged to be able to come. And look, the folks here, they know kind of all this stuff. They know where it is. But like I said, particularly people, once you're like 50 and above, you're pretty much going to qualify for this treatment. And so it isn't going to be like people are going to be turned away. Look, if an 18-year-old marathon runner comes in who's like in perfect shape and perfect health, that probably wouldn't fit into the EUA. But by and large, folks that are at risk are going to be able to do it, and that is standing, and it does not require that you consult with a physician. beforehand, that's up to you, and it definitely doesn't require you to actually get a prescription. And that has one of the reasons why I think it wasn't known as much is that the hospitals were offering it, even some individual physicians were, but it was based on physician referral. So it wasn't anything you could just go do. Now we've been able to open it up more, I think, and make it more accessible, raise the visibility, but also make it more convenient for people. And again, when you're in a situation where you have higher prevalence in a community, you gotta just recognize that there's going to be people that are gonna need this, and so we're glad that is the case. Okay, I got to go to the next one, but we'll see you guys soon. We'll take care.
School, you brought it up, Governor. It's fair game. Additional consequences. What are they for the schools? Why won't you answer my question?
Everybody treating you right?